Welcome to Expert Medical Coding. In today's video, we are going to learn about Crohn's disease. We are going to see what is Crohn's disease, what are the symptoms of it, what are the causes of it, what are the diagnostic tests available to diagnose this condition, what are the treatment options available, and precautions. So, let's get started. What is Crohn's disease? Crohn's disease is a type of inflammatory bowel disease that causes inflammation and irritation in your digestive tract, especially in your small and large intestines. Now let us see the symptoms of this condition. If you have Crohn's disease, symptoms you might have can include abdominal pain, chronic diarrhea, a feeling of fullness, fever, a loss of appetite, weight loss, abnormal skin tags, anal fissures, anal fistulas, and rectal bleeding. Now let us see the causes of this condition. The first cause is autoimmune disease. Bacteria in the digestive tract may cause the body's immune system to attack your own healthy cells. Second cause is the genes. Inflammatory bowel disease often runs in families. If you have a parent, sibling, or other family member with Crohn's disease, you may be at an increased risk of also having it. Third cause is the smoking. Smoking could double your risk of Crohn's disease. The next cause is the NSAID medications. These include ibuprofen, naproxen sodium, diclofenac sodium, and others. While they do not cause Crohn's disease, they can lead to inflammation of the bowel that makes Crohn's disease worse. Now let us see the complications of these conditions. Crohn's disease may lead to one or more of the following complications. They are bowel obstruction, ulcers, abscess, fistulas, anal fissure, malnutrition, and colon cancer. Now let us see the diagnostic test available to diagnose this condition. To find the cause of your symptoms, your healthcare provider may order one or more of these tests. The first diagnostic test is the blood test. A blood test checks for a high number of white blood cells that may indicate inflammation or infection. Next test is a stool test. This test looks at a sample of your stool to check for bacteria or parasites. It can rule out infections that cause chronic diarrhea. The third test is a colonoscopy test. During a colonoscopy, your doctor uses an endoscope to examine the inside of your colon. Your doctor may take a tissue sample biopsy from the colon to test for signs of inflammation. Next diagnostic test is the CT scan. A CT scan creates images of the digestive tract. It tells your healthcare provider how severe the intestinal inflammation is. Next test is the upper GI endoscopy. Your doctor threads an endoscope through your mouth and into your throat. An attached camera allows your doctor to see inside. During an upper endoscopy, your doctor may also take tissue samples. The next test is the upper gastrointestinal exam, that is GI exam. X-ray images used during an upper GI exam allow your doctor to watch as a swallowed barium liquid moves through your digestive tract. Now let us see the treatment. Your healthcare provider may recommend one or more of the treatment for Crohn's disease. They are: the first treatment option is the antibiotics. Antibiotics can prevent or treat infections. Next is the antidiarrheal medication. Prescription medications like loperamide can stop severe diarrhea. Next one is the biologics. These medications include monoclonal antibodies to suppress the immune response. Next one is the bowel rest. To give your intestine a chance to heal, your provider may recommend going without food ordering for several days or longer. To get the nutrition you need, you may receive intravenous nutrition. Next treatment option is corticosteroids. Cortisone, prednisone, and other corticosteroids ease inflammation brought on by autoimmune disease. Next option is immunomodulators. These drugs calm inflammation by suppressing an overacting immune system. They include azathioprine and cyclosporin. Next option is surgery. Surgery actually won't cure Crohn's disease, but it can treat complications. You may need surgery to correct intestinal perforations, blockages, or bleeding. Prevention. These healthy lifestyle changes can ease symptoms and reduce flare-ups. They are: stop smoking, eating a healthy, low-fat diet, exercising regularly, and managing your stress. Please like, share, and subscribe to Expert Medical Coding. Thanks for watching.